Hi, it's very important to take note that anxiety attacks and panic attacks usually happen when you really don't know what's going on and what situation you're in. So with this in mind, you will realize actually that the only way to be able to fight off getting anxious or getting worried about your situation is to equip yourself with the needed knowledge to be able to actually cope better. First things first, what you need to remember is that every pregnancy experience is different. Okay, so whatever your friend or your relative experience doesn't mean you're going to experience. So stop comparing your pregnancy journey to everyone else's pregnancy journey. Your pregnancy story and experience actually depends on several things. Number one, your total health status. Number two, your mental stability and disposition. Number three, all the experiences that you've had. Number four, your nutritional status. And number five, all the support group that you have, your family and friends that are around you during this pregnancy. So let's now talk about what you need to know and what you need to do. Okay, fact. If the woman is healthy, then the chances of a healthier and uncomplicated pregnancy is actually higher. So if you're still in the planning stage, make sure that you actually, practice healthy lifestyle already by sleeping early, getting actually enough sleep. When I say sleeping early, you actually need to sleep within the 10 p.m. to 2 a.m. Interval, because that's the time that the body replenishes the hormones that we used up for the day. So if you don't get to sleep during this time most of the time, then you are more prone to actually having hormonal imbalances, and this will actually make it a little more difficult for you to get pregnant. Or if you do get pregnant, medyo mas pwedeng magkaroon ng mga possible complications. Okay, so sleep early, sleep at least 6 to 7 hours a day. Eat healthy. Okay, a well-balanced meal is actually the foundation of everything. Okay, eat your gulays, eat your proteins, have fruits every day, and then stay away from sugary treats, please. If you can, and you must actually limit your caffeine intake to at least 1 cup a day na lang of coffee. Also, have yourself checked regularly para sure kayo na healthy kayo. So, eating healthier and being healthier and living a healthier lifestyle is equal to a healthier pregnancy. Thus, lesser things to worry about. So, watch out for the continuation of this video. Okay, let's continue with the video, how to cope with anxiety during pregnancy. Okay, next, you have to surround yourself with people that you love, people that you draw strength from, and the people who will understand you despite and in spite of all the brattiness that you display during the pregnancy. Alright, okay, next. Okay, things that you don't have to worry about. So, it's normal that you actually, that you have occasional pain in the lower back or in the puson. Now, as long as it gets relieved after resting for about 10 to 15 minutes. Pero syempre, kung hindi siya ma-relieve, then that's another story. Okay? It's also normal to vomit any time of the day. The morning sickness does not happen just in the morning. It can happen anytime. Okay? Third, yung baby bump, normal na hindi mo siya makita until 4 months. Kasi usually, bigla lang laki ang tiyan pag 5 months. This is because the uterus actually grows front and back for the first 4 months. So, pusunin ka lang talaga. That's why, during this time also, mas madalas ka umihi, may konting parang pressure sa back, kasi dahil dito sa growth ng uterus. After that, on the 5th month onwards, ayan, biglang laki ng tiyan mo. And next, okay, whitish vaginal discharge is normal as long as it's not itchy and it doesn't have any smell. This is usually called the lochia of pregnancy. However, all other discharges like brownish discharge or spotting or bleeding is not normal, and you should actually inform your OB once may manotice kang ganito. And as I've said in my video entitled Quickening, for the first 3 months of the pregnancy, usually hindi mo talaga mafe-feel si baby. Or hanggang 4 months. May mga iba, medyo mas sensitive sila, so may mga tusok-tusok or may mga biglang nagpa-flutter, yun pwedeng movement ni baby yon, or pwede rin naman gas. But usually you feel the movement ni baby if you're a first-time mom from the 18th to the 20th week. However, kung second or third or fourth pregnancy mo na, it's going to be earlier sa mga 16 to 18 weeks. So that's how you actually cope with anxiety and worry during the pregnancy. Equip yourself with the knowledge that you need. Keep in close touch with your OBGYN. If there's any question, feel free to ask her. And as much as possible, please, again, do not compare your pregnancy journey to someone else's pregnancy journey kasi iba-iba talaga.